Este paciente sangró. Hello. Hola. So good morning, good evening, good afternoon. It will depend where you are. So today we have. I would like to show just common use of patients of the treatment of patients with portal hypertension. And today I would like to introduce for Latin America uh, the new band ligation kit is coming from Microtech. I would like to show the box. This is a small box, huh? It's coming inside. ¿Tienes otro de estos? Entero. So this is very nice band ligation kit. So I will use today this. So you see the rubber bands are yellow, and you have a black one rubber band, and the black one show you when you are just about to finish. So we have 7 rubber bands, so we can do 7 shots. Okay, so very nice. I like the presentation also. So it's very easy to use. It's similar to use it as other band ligation kits. And we have a patient, 70 years old patient with recently upper gastrointestinal bleeding that was sent to our center to do a treatment. So this patient have esophageal varices due to portal hypertension, and also um, uh, hypertension, gastric erythema due to portal hypertension, as you can see here very well with eye scan. And this patient already had some treatments, because we see here the scars of band ligation, previous band ligation. So what is very important is always that the rubbers need to be very good, because sometimes it's difficult, and if the rubber is not good, doesn't have good pressure, it can be delivery, and a bleeding during the procedure could appear. So the idea is to have this. Sometimes we can have some difficult situations in some patients when has those patients had been treated for years, as this patient, you know, uh, with the scars. So sometimes the esophageal epithelium becomes very hard to treat. In those cases, you have other alternative you can see in our YouTube channel. But today, I believe there is not issues with this patient. This patient doesn't have gastric varices. It's very important to evaluate that. So this is good. So the the proposed treatment, the proposal today is to do a band ligation using this new kit. So I want to try this new band ligation. So I want to say hello to my good friend Chris Lee. Chris, I will try for the first time this band ligation. Thank you for the support. So now I have my technician here. So you can see here. I want to show you. So you need to pass. Me pones en grande, por favor. You need to pass a catheter to recover the other part of the band ligation here. You see here. So you have this is the Microtech band ligation. It's very similar to the Cook one. So you have unlock and lock area. Um, and and then when we have here the distal part outside of the scope, we need to catch this. It's okay. So now it's okay. You can see, and now we introduce inside the working channel of the scope, and we will recover this outside. So you see the distal part, and this is the distal part. So now we need to introduce this inside, in the distal part of the scope. Okay, so now we will do it. Okay, hello, hello, hello. Okay, ponlo bien. So this is very important. I need to show the visualization of the scope. Endoscopía, por favor. So now we have already put the band ligation, the distal part of the band ligation. You can see the yellow rubbers, but this is very important. You see the central part. You don't need to see the black rubber, because if not, the position is not very well. So it's not well placed, the your band ligator. So now I am introducing one of the advantage of the difference between the other band ligation kits is that the distal part, the cap, is smaller. So this is a good advantage. I believe could have some potential in pediatric patients also, and we will see how it works now. So this is a very big test, because we have a patient with bleeding, with red spots, and big varices, esophageal varices, and with history of scars because or due to band ligation, previous band ligation. So now we will start here in the cardia. You can see here. It's very important to do very well and to see exactly where you will start your treatment. Okay. So now I'm here. I will start here. So the aspiration is good. So now the band was delivery. You can feel it. This is good, and you can see very well the rubber attached to the varice. Okay. So now I will do my second shot here. So we have here some one scar, a scar due to previous band ligation, but you see the introduction of the varice is good, in spite of the diameter of the cap. Let me see the diameter of the cap. Is the same? Is it similar or to other ones? So it's a little bit. So I will continue. It's very important to see where you will perform where you deliver your band ligation, your rubber, where you will perform the band ligation. Try to avoid the scars, it's very important. Except when you have a red spot over the varice, over the scar. In those cases, other treatment can be applied. So I think we are very good here. I don't have more varices. Maybe here. So now I start to see the band, the black one band, rubber, and this is very important because in this moment, you know, yeah, that you have just two more shots. So I believe it's not necessary more ligation. So I am happy with the treatment. Let's go to see in 8 weeks or 6 weeks how is going this patient. So thank you so much for assisting us. So Chris, my friend, the band ligator kit is good. Okay. So thank you so much.